Picture so important, as we've learned through the weeks. Here's the Prime Minister of Canada, and let's go to him now.
Good morning, everyone. I know many of you have seen reports about my mum. I want to let you know that I've spoken with her and she's doing just fine. I'm thankful to everyone who's reached out and want to also thank the first responders who were there doing an extraordinary job. This morning, our thoughts go out to those of you who live in Fort McMurray as you deal with spring flooding. Minister Blair has spoken with Mayor Scott about the situation, and we stand ready to help. To all the first responders and volunteers out there placing sandbags, including around the hospital, thank you. Across the country, there are other communities dealing with flooding right now too. So to everyone, continue listening to officials as they work to keep you and your family safe. This comes during what's already a tough time, but I know Canadians will continue to work together. Shortly, I'll join members of Parliament from across the country for a virtual meeting of the House of Commons. Despite the challenges of this pandemic, our democratic institutions are innovating and finding ways to keep serving people. Parliamentarians are working together with the same goal, supporting Canadians and keeping our country strong. As part of this sitting, at noon, Minister Hajdu will provide an update on the new COVID-19 modelling, and Dr. Tam will also do the same. Based on the best data available, this is an updated picture of where we think we are right now and where we think things will go from here. They'll provide more details, but here's the bottom line. The measures we've taken so far are working. In fact, in many parts of the country, the curve has flattened, but we're not out of the woods yet. We're in the middle of the most serious public health emergency Canada has ever seen, and if we lift measures too quickly, we might lose the progress we've made. So we all need to be very careful for ourselves and especially for the most vulnerable, like our parents, grandparents, and elders in long-term care facilities. Earlier this month, when we released the first modelling, I said that the path ahead was up to us. And the same holds true today. How many new cases there are, how many losses we have to mourn, whether our hospitals can continue to cope. It's all up to all of us. You've already stepped up to help your family, friends, neighbours, and frontline care workers stay safe. And your governments across the country are stepping up as well. We're a big country and we don't always agree on everything. But right now, the premiers and the federal government are working together to fight this crisis. We need common guidelines to make sure that the decisions being taken across the country are grounded in a shared understanding and appreciation of what science and experts are telling us. Shortly, we'll be releasing the shared principles on restarting the economy agreed to by the federal, provincial, and territorial governments. Let me be clear. These are not the specific measures when you can go back to work or school or when you can see your neighbours or extended family or friends. This framework will lay out the things that need to happen before we take any next steps. Restarting our economy will be gradual and careful and will be guided by science. Here's what the guidelines mean for you. Controlling transmission is key. You already know that if your neighbourhood doesn't have new cases, if your province is flattening the curve, this is a good sign for being able to slowly look at lifting some restrictions. So we need to know where things stand. To reopen the economy, there must be enough capacity to test and trace COVID-19 to control any new spread. For you, that means knowing that you'll be safe at work when you go back. You'll see lots more testing, and if someone around you does test positive, you'll be notified quickly so you can isolate. At work, there will also need to be specific measures and more equipment to keep you safe. And for hospitals, we need to make sure they can continue to cope not just for COVID-19 patients, but for everyone who needs care. And for certain groups who are very vulnerable, like seniors and those in long-term care facilities, strong measures will have to be in place for longer. This virus is taking a different toll on different people. We must be mindful of that. Whether you're facing domestic violence, or living in a remote community, or a long-term care facility, we're working on the front lines. We're here for you. Our priority is keeping all Canadians safe while getting back to normal as much as we can. Aujourd'hui, on publie les dernières
Today,
prévisions.
we are presenting the most recent predictions with respect to the evolution of COVID-19. In many regions, COVID has slowed down, but we're not out of the woods. We are in the midst of one of the most serious public health emergencies in the history of our country. And if we lift the restrictions too soon, we could lose all the progress we've already made. Even though the trends are encouraging, we must remain cautious. There are some places, particularly in seniors' homes, where we're going to have to do more. And as I've already said, every single one of us will decide on how things proceed, how many new cases we'll have, how many families will be mourning, whether our healthcare system will be able to cope. All of this depends on all of us. The good news is that people are taking the proper actions to protect themselves and others. But we must continue. We must continue to stay home and go and do our groceries once a week and keep a 2-meter distance from others and follow the public health directives. Soon, we will be sharing all the common principles with respect to restarting the economy on which the federal government and provincial and territorial governments agreed. These principles will set out the conditions that must be in place before we can begin to lift the restrictions. For example, the ability to test and trace COVID-19 must be sufficient to be able to control the spread. And that's why we are intensifying testing and putting in place the necessary tools as quickly as possible. There must also be specific measures and new equipment to protect people at work. And for certain particularly vulnerable groups, such as seniors and people living in long-term care facilities, more robust measures will have to remain in place longer. Our priority is to ensure the safety of all Canadians as we start to see normal life return.
Provide an update on personal protective equipment, which, along with physical distancing, is key to keeping people safe. Every few days, we receive new deliveries of vital supplies for our frontline workers. This week, we'll be shipping over 6 million surgical masks to the provinces and territories. More than 100,000 face shields that we ordered from Bauer and Toronto Stamp are also ready and will be shipped out soon, with more on the way. Everyone deserves to be safe on the job. Indeed, on this National Day of Mourning, we remember those who died, were injured, or fell ill because of their work. And this year, we pay tribute to the thousands of frontline workers across the country who deserve not just our thanks, but our support. Aujourd'hui,
Today, I'd also like to update you on individual protective equipment that ensures the safety of our frontline workers. We are receiving shipments of medical equipment several times a week. This week, we will be sending more than 6 million surgical masks to the provinces and territories. More than 100,000 face shields that we ordered from Bauer and Toronto Stamp are also ready and will be sent out very soon. Everyone deserves to be safe at work. On this day of national mourning, we remember those who lost their lives, who were injured, or who fell ill as they did their job. And this year, we are saluting our frontline workers across the country who deserve not only our thanks, but also our support. I also want to remind everyone that the businesses that require a wage subsidy can now apply online. Since yesterday, more than 44,000 businesses have already applied online.
to get through this, we must work together, and we must stay united. Now, more than ever, we have to stand up against discrimination and division. There is no place for racism against Asian Canadians in our neighborhoods. There is no place for anti-Semitism, which B'nai B'rith Canada's report found to be on the rise in our communities, because hatred of any sort has no place in Canada. Today and every day, we are stronger together. Merci.
Thank you, Prime Minister. We'll now take questions on the phone. Over to you, operator.
Thank you. Merci. First question, Kate Bolongaro, Bloomberg. Line open.
Hello, Prime Minister. I have a question regarding the wage subsidy. We've heard from some businesses that it will cost them more money to rehire employees they've already laid off and had to pay out holidays and severance pay to than to bring them back on board with this wage subsidy. So some of them would rather leave their former employees unserved. What is your response to this?
Ideally, people will keep their connections with their workplaces so that they can know that they have a job to return to when this is over. And when the economy comes back, it will be all the quicker because Canadians will have stayed connected to their jobs. We were pleased that over 44,000 businesses have applied for the wage subsidy. But we know that there are a range of different situations across the country, and employers have had to take some very difficult decisions because of COVID-19. We've put in place measures to support the people who need support most urgently with the Canada Emergency Response Benefit and the wage subsidy. And we certainly hope that all these measures together will ensure that Canadians can continue to do what we need to do while caring for their families and come back as strongly as possible at the end.
Follow-up, Kate.
And now we've got a lot of personal protective equipment for the frontline workers. I'm wondering, do you expect businesses to chase PPP as well now that the reopening of the economy is beginning to be considered? And do you think there will be enough masks and gloves available for all of the businesses that will need them to be able to operate?
Our priority over the past weeks has been to ensure enough personal protective equipment for our frontline workers who are doing extraordinary work to keep us all safe. But we also know that as different provinces look at starting to reopen certain sectors, certain industries, certain parts of the economy, there is going to be an increased need for personal protective equipment. That's why we continue to procure massive amounts of PPE from overseas, while at the same time watching the Canadian production come online so that we can have our domestic capacity to rely on as well. We know that having the right amounts of PPE for industries that want to reopen will be essential before they reopen, and that's why we're accelerating the rate at which we are taking in personal protective equipment. Okay. Nous savons que la priorité a toujours été.
We know that the priority has always been to ensure there is enough PPE for our frontline workers and healthcare workers, and that's why we've been working very hard in recent weeks. But as we are now looking at the next steps and the possible reopening of the economy, we know that there will be a need for more personal protective equipment, and we intend to increase the rate at which we receive that equipment. And we also have the domestic production coming online that we will be able to share with people before we begin to reopen the economy.
Thank you. Merci. Next question, Laura Osmond, the Canadian Press. Line open.
Good morning, Prime Minister. I wanted to ask you again about vaccines. If and when a vaccine does become available, do you envision it being mandatory? And have you had those discussions with the provinces and territories yet?
We are still, unfortunately, a long way from having a vaccine. And just finding the vaccine is the first step. The next step will be producing the vaccines in sufficient number to inoculate everyone or almost everyone. That is something that we are preparing already in terms of manufacturing and production capacity here in Canada, because we know that countries around the world will be producing for their own citizens first, and we need to be part of that as well. As to what sort of vaccination protocols will be in place, we still have a fair bit of time to reflect on that in order to get it right. Par rapport aux vaccinations, nous reconnaissons que on est encore loin de cela. Des pays à travers le monde sont en train de chercher un vaccin contre la COVID-19. Même une fois qu'on l'aura trouvé,
but even once we have one, that could take 6 months or a year, we will have to produce that vaccine in sufficient quantities to be able to protect citizens. So we are currently putting in place a proper production capacity here in Canada so that we can respond respond to the demand in Canada as soon as possible. Now, what will the protocols be? Who will be vaccinated first? Those are things that still need to be decided, and we have time to be able to make the right decisions in that regard.
Thank you. We've heard over and over how vital a vaccine will be because we don't fully understand the immunology of this virus. So how vital will it be to make sure that as close to everyone as possible ends up getting it in the end if one does become available?
We know vaccines will be extremely important. A vaccine will be extremely important to getting back to normal. There are situations and there are diseases for which vaccines have been searched for a long time. I think of HIV/AIDS, where there is still no vaccine even after decades of research into a vaccine. There are treatments to manage the spread of HIV, and there could be treatments that aren't a vaccine that could help us manage and get back to normal without a vaccine. But around vaccines, there are obviously going to be extremely important decisions around how to best get to that level of vaccination that will prevent further spread of COVID-19. There's a lot of studies done on that over the past years in terms of what threshold of the population needs to be vaccinated in order to prevent any spread of a disease, and that research will obviously inform decisions we take around the COVID-19 vaccine when it comes. Okay.
Of course, there's a great deal of research being done on vaccination and the level of vaccination that is necessary in order to protect our population and avoid the spread of the disease. That will certainly inform our choices when it comes to vaccination against COVID-19, but it is still quite possible that there will not be a vaccine. For over 10 years, there's been aggressive research on a vaccine on HIV, and there isn't one yet. But there are treatments that will make it possible to manage that disease much better than before, and we are seeking treatments as well that could help us to manage COVID-19 if the vaccine takes longer to be developed than we hope. So we're working on all these different options so that we can do everything we can to return to normalcy as soon as possible.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Good morning, Mr. Trudeau. With respect to the shared principles at the national level, you said that the details will be coming. Now, concretely, does the federal government intend to prohibit travel and certain movements between provinces? Well, that's a very good question, Mélanie. First of all, with respect to this common approach that we've developed and the shared principles we agreed on between the federal government and the provinces and territories, we should be sharing that with you in the next hour. But as I say, these are not specific measures. These are basic principles that will inform the measures to be taken by various governments based on their own circumstances. Now, with respect to cross-border movement, the provinces will look at their situation, and the federal government will also review the situation and will consider the principles and figure out what kind of decision has to be made to ensure everyone's safety. So this is a process that will be evolving in the coming days and weeks as we see an evolution in the spread of the virus.
This framework is one where the federal government and the provincial and territorial governments all came together to agree on principles that will underlie plans for economic recoveries. Those plans will be different from one province to the next. The specific measures put in will depend very much on the situation on the ground. But we need to be informed by a common set of criteria and measures to be in place before we look at reopening different parts of the economy. This is something that really, really matters. And all of us will be informed by these principles as we move forward on carefully reopening the economies in gradual ways.
And suivi, Melanie?
Follow up?
Maintenant,
Yes.
selon un sondage, M. Trudeau, il y a
Now, according
60% des
to
Canadiens qui
polls,
croient qu'un éventuel
60% of
vaccin
Canadians
contre la
think that
COVID-19
a vaccine against COVID-19 should be mandatory. What do you think of that idea? As I said, we're very far away from the time when we can make that kind of decision, or we'll have to make that decision. A vaccine is not going to happen overnight, and there are many studies that have to be carried out on the nature of COVID-19 and how we can protect the population. We know that with respect to other vaccines, in some cases, there needs to be 80% immunity in the population to prevent the spread of a specific disease. Now, we don't know whether it will be the same threshold for COVID-19. That will be based on the science and the research that's underway now, as well as by the COVID-19 immunity task force that we've set up and which will be working from Montreal for the entire country. And that will inform all of our decisions as to what the next step should be.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Benjamin Vachet, TFO. À vous.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau.
Santé Canada hier a
Health Canada
décidé,
yesterday
de lever certaines
decided to lift
restrictions
certain
sur
restrictions
le pour les produits nettoyants. On
with
sait que
respect
ça a
to
été
cleaning
une mesure qui a été
products,
prise aussi pour les produits
and
désinfectants un peu plus tôt dans la pandémie. Le commissaire aux langues officielles
the
du Canada,
Official
la semaine dernière,
Languages
disait que c'était
Committee
justement et que c'était une question de sécurité.
says that
Pourquoi
this
alors
is
avoir
about
pris cette
people's
décision et
safety.
pourquoi on ne
Why
peut
was
pas
that
coller
decision
notamment des étiquettes
made?
temporaires sur les produits qui viennent des
And
États-Unis,
why
par
should there
exemple?
not be proper information on products coming in from the United States? That's a very good question. We need to protect the safety of consumers, and products must be labeled in both official languages. But in an extreme situation such as the one we're in now, we also recognize that there needs to be a proper balance between some vulnerabilities, and in some situations we are ready to permit unilingual information on packaging, but as I say, companies are working hard to try and rectify that. This is not something that should be accepted in Canada, and it's really just because of the extreme situation in which we find ourselves. We decided to authorize this, but we would certainly prefer that this not happen, because our linguistic duality is not just a question of our Canadian identity, it's also a question of safety for consumers. Does that mean, Mr. Trudeau, that there could be other exemptions in the coming weeks? Well, we hope we will not have to authorize other exemptions. We do hope that we can provide the proper labeling in French and English on all products as necessary, but we're now in a situation where labor and logistics are not always sufficient within these companies to make that happen. And that's why we decided that in this case it was better to ensure that the products could come in, and we're trying to ensure the safety of consumers at the same time.
Minister Janet Silver, Global News. I want to start with the situation in Alberta. First, we have the COVID-19 outbreak of the meatpacking facility there, and now the flooding in Fort Mac. And you said in your opening remarks that your government is ready to help. I'm just wondering, will the military be brought in to help in that situation?
Public Safety Minister Bill Blair has already been in direct contact with Mayor Scott in Fort McMurray and spoken with his counterparts in the Alberta government. On the agriculture side, we've been engaged with the CFIB and with the relevant ministers in Alberta. We stand ready to help in any ways we can. And as in regards to military support, we're there for military support if we receive a request from the province. Nous allons être là pour aider.
We will be there to provide support to the provinces in these different situations. In terms of military intervention, we're certainly open to that, but we need to receive a request from the province.
To reopen the economy, there must be enough capacity to test and trace COVID-19 to control any new spread. Dr. David Naylor of the COVID-19 Immunity Task Force says he's really concerned about testing and tracing capacity. So I'm wondering, how is your government planning to address those concerns as provinces reopen?
We know we need to do much more testing. We know that testing is an important part of careful reopening of the economy, and that's why we are increasing our capacity. Yesterday there were 26,000 tests, which is a new high, and we're continuing to increase the testing capacity with various things like more procurement of necessary swabs and domestic production, with production of the reagent, which is the chemical necessary to analyze the tests, done in New Brunswick right now to a quantity and a scale that is going to allow for larger scale testing across the country. There are many things that the federal government can do to support the testing protocols and capacities in the provinces, and we all need to improve on that if we're going to get to a place where we can open up carefully. Okay. Le dépistage à l'échelle massive va être
massive testing will be an important component of reopening the economy, and that's why the federal government is now working with the provinces to increase their capacity. We conducted more tests yesterday than before, 26,000 across the country, and of course we must do more. And we are now ordering more testing equipment. We are also creating the necessary chemical reagents so that the entire country can conduct more testing. We know that we absolutely must do this before we start to reopen the economy. Radio-Canada, a specific question. How many tests will it take before we can reopen the economy? You've talked about common principles, but what are those principles? How many tests and what other measures will need to be in place to ensure that this works? Try to be as specific as possible. Well, to be as specific as possible would mean telling me which region you're talking about. Well, I mean right across the country. Well, I can tell you that we're dealing with a series of different pandemic responses and situations across the country. In Prince Edward Island, there were 20 cases. In Ontario and Quebec, we know that the figures are much, much higher. So we're talking about very different realities right across the country and different realities from one city to the next. So for us, the important thing is to allow the provinces to do the level of testing that is necessary in each region and each community in order to respond to needs and to the vulnerabilities on the ground. For example, there are communities where they may decide to test everyone. There may be workplaces where they want to test 50% of the people there. So there are different protocols, and our responsibility as a federal government is to ensure a much increased capacity so that the provinces can conduct the level of testing that they believe to be necessary for based on where they are and the circumstances involved. We cannot say exactly tomorrow we need these many tests done. No, this is something that is an ongoing process, and our responsibility is to be there for the provinces to ensure they can do that testing. Now, with respect to the provinces, now in your modeling, are you considering reopening the schools in Quebec? Can New Brunswick say, no, temporary foreign workers cannot come into our province? Well, the different provinces will have their own approach, and our pan-Canadian modeling tries to reflect those different realities. But it is only an overview of the country. The fact is is that there is a different reality in every place across the country. And in terms of the different measures the provinces will bring in, well, they will make their own choices within their own jurisdiction that they believe are the best ones for their citizens. Good morning, Mr. Trudeau. I'd like to come back to Health Canada's decision. There are a number of Francophones who are extremely offended by this. Senator Cormier said nothing justifies violating the Official Languages Act. What do you think justifies it, and what do you say to them? Well, we are in an unprecedented situation where access to products such as hand sanitizer is absolutely critical. It's an essential component. It's an essential thing that Canadians have to do to stay safe. So we had to make decisions that would be absolutely unacceptable at other times and say that in some cases we can allow those products to come in with unilingual labeling. But of course we understand that that certainly is not ideal either for the identity of our country or for consumer safety. So we do hope that this will not become a regular occurrence and that people, we know that people are now looking at ways to avoid using only unilingual labels.
I'd like to ask you about Quebec's move to reopen its elementary schools and daycares. I know it's a provincial decision, but I'd like to ask you as a parent, if you'd be concerned about sending your kids back to school so early, and as a former teacher, do you have any concerns about the teachers who are going to be called back to the classroom?
I think many people want to see the economy reopening and getting back to a semblance of normality in the coming weeks. It is natural that after a long time in isolation, we would want to see things move back towards normal. At the same time, we know we have to be very, very careful. And there are plans and there are hopes that we're going to be able to see certain parts of the country take steps, including Quebec, around elementary schools. But we're not there yet. Those projections are for a few weeks off, and one hopes that the trend lines will bring us to a place where we'll be able to see that happen. And at that moment, as the Premier said, parents will be able to make their own decisions about what is best for their students and for their kids. Okay. Je pense que nous voulons tous voir.
I think we all want to see solutions in the short term and a return to normalcy as soon as possible. But we all know that that will take some time. Even with our plans to take action in the coming weeks, we will have to ensure that the context or the situation on the ground at that time will allow us to make those decisions. And at that point, the schools and parents will be able to make their own choices as to what should be done to protect children and to keep their grandparents safe as well.
CTV National News. I just want to follow up there because there was a question about what you would do if you were a parent. Have you given that some thought? In 2 weeks, would you send your kids back to school if you were in Quebec?
I would look at what the situation looked like in 2 weeks. We know every single week we see changes in how we're doing, on where there are outbreaks, on equipment and supports available. I'd want to know what the school was planning on doing, whether the desks were going to be properly spaced, whether there would be plans at recess in terms of keeping people separated. These are all details that need to be worked out to the satisfaction not just of governments, but of the school boards, of teachers, of everyone who works in the schools, and especially of kids and their parents and grandparents. Okay.
As a parent, when I make a decision for my own children, I will want to know what the measures are that are in place. Will there be fewer students per class? Will the desks be properly spaced? And now in the playground, will there be rules in place to ensure that kids keep the proper distance from each other? Where will there be measures to protect the teachers and to make sure that they can work safely in the schools? And will there be measures that will allow them to respond in the case of a problem? So these are all questions we'll have to have answers to before we can make a decision about reopening. And that's exactly what I'm expecting to happen. I believe all levels of government, all parents and all institutions are asking these questions before they decide to relax the restriction.
Framework that you've discussed with the premiers and the modeling numbers that are coming out today, there is another brewing healthcare crisis as well because of all the the elective surgeries, right? So people that are perhaps waiting for important cancer surgery now are very uncertain as to when that could happen. So when you're discussing this with the provinces, you're looking at the modeling numbers. What benchmarks are there to start to reopen those type of important medical procedures that are sort of separate from this COVID-19 epidemic?
That is an extremely important element of any reopening and of our healthcare capacity. Of course, while we are dealing with a massive COVID-19 crisis, there are still people who need surgeries, who are facing difficult treatments, who need to access our healthcare system for other reasons. And that is why part of the frameworks agreed to by the provinces and the federal government includes healthcare system capacity, not just to handle a potential resurgence of COVID-19, but how to handle the regular needs of patients who are dealing with health issues that are not COVID-related. Okay. On sait que même dans un moment de
We know that even in the middle of COVID-19, where we're facing huge challenges with respect to the capacity of our healthcare system to cope, we know that there are also people who need special treatments that have to go to hospital for emergency problems, and we have to be able to maintain the necessary capacity for them. And that's why in terms of the principles that have been agreed on by the federal government and the provinces with respect to reopening the economy, we have to make sure that our healthcare system also has the necessary capacity to respond to a resurgence of COVID-19, but also respond to any medical emergencies and provide medical treatments that are needed by the population.
Merci beaucoup.
And that is the Prime Minister of Canada giving his daily update to Canadians on